This is Charley Hogwood with Survival Dispatch. Just a quick update on the flu situation going on in China and is spreading around some other countries in the Middle East and even over to the US now. The current situation that we have is a new coronavirus has gotten some legs out of China. The virus strain is a new strain sort of related to SARS, but it's mutated a little bit. It's now transmissible between humans and is being called the China coronavirus. China is putting the entire city of Wuhan on lockdown and asking for social distancing and non-travel. The city population is roughly 11 million people, so that's going to be a bit of a challenge to get everybody to stay home and not mingle in public places. So far, one case has made it to the United States in Washington State, and it was reported that that case was not a direct travel from China, so that's going to have a little bit of effect on how U.S. airports are going to deal with the situation of international travelers. The virus has been detected in 6 other countries as of this video, and the big trick with this is that this coming weekend is the Chinese New Year, which invites a lot of travel internationally and within mainland China. So that's going to be a big deal to see how that is going to play out. The World Health Organization is going to meet today to determine if the outbreak is going to be a global health emergency, so we'll see what happens. So we'll keep you updated if anything gets any worse on that. But I've had people asking me some questions. So some of the questions are, well, what should I do about this? Is this something I should worry about? Well, let's see. Until we get more information, if this is going to be something bigger, we really should just focus on the stuff that we should already be doing. So that's going to be proper hand washing, considering our travel plans to busy places with lots of people, being good parents and friends, making sure our children are washing their hands, making sure that we're not all over public things like doorknobs and escalator handles and elevator buttons and bathroom doors and faucets and toilets and all the usual other things where pathogens could spread. So that's all the usual stuff. I would say if you're around people that are coughing and sneezing in public, try to imagine when people are vaping, you can see that cloud of mist and droplets spreading out through the air. That is kind of a visual representation of what lung air, when it's respirated or coughed or sneezed, how it passes around the atmosphere around us. So when you see that, you realize, okay, that's how normal breathing in droplets or coughing or sneezing could be spread around in public places. So maybe, you keep your usual distance from people, especially if they're acting like they might be sick. So since we're still in a busy flu season and the vaccine wasn't very well matched to this flu season, we should be careful anyway. So we have a bigger chance of catching the common flu this year than we do the China coronavirus, as it's being called at this point. So just use your common flu prevention tips. In the meantime, keep up your preps. It's a good opportunity to think through what you might need around the house. Do you need some more Lysol? Do you need maybe some kind of a mask or something if you've got in public places? Think about things with eye protection. So it's just a little exam mask. It's got a lens on it. You can carry in your pocket, these are little 3M N95 masks. This is the model 9210. So just a simple little respirator mask. If you go out in public, maybe you want to carry some gloves and a little bag. That's super simple. All that fits in a sandwich bag. A sandwich bag like this can fit in your pocket, purse, backpack, cargo pocket of your pants, wherever you are. Just throw it wherever you go, your briefcase. And if you get around a bunch of people that are acting like they're sick, you have everything you need with you. Include in there some germ wipes, a little Germ-X or Purell hand sanitizing wipes, maybe the little bottle of hand sanitizer. That kind of stuff is really handy to have. So that's the kind of stuff you'd have with you, maybe in your car, maybe at work, maybe at school, and then at home, of course, all of your typical cleaning products and stuff like that. So essentially, when people ask me, well, what can I do, what can I carry, follow the general rule of disease prevention that we've said before here at Survival Dispatch. If it's warm, wet, and not yours, Don't touch it. So check out our December issue of Survival Dispatch Insider. It's called Germ Warfare. We talked about all of these things that are going on right now already, just this last December. So if you'll go to insider.survivaldispatch.com, you'll see the Germ Warfare issue and all the previous issues that we've had, and you can check those out for free. See what we have to offer here at Survival Dispatch. And until next time, if I have any more updates, I'll bring them out to you, but be safe. Thanks.